Me. All right, it's live.
Okay, cool. So, pull up my Word document. You guys still see me?
Mm-hmm.
Yeah.
My interview, I interviewed my friend Alex McKenna, and he is a healthcare program financial analyst associate. And for question number 1, what do they do? He works with hospitals and streamlines their financial balances, incomes, and expenditures. And it's like more like the business side of healthcare. So he analyzes like the procedures and practices that a hospital does and like how much they cost, and determines whether they're utilizing their resources like to the best of their ability. And he'll suggest like, oh, maybe you should take out this procedure so you can focus more on this procedure, you know? So like he'll say maybe you should do less MRI so you can focus more on cancer research or something like that. Question number 2, how do they work with psychology, and how does psychology affect the profession? Psychology affects his profession because he interacts with people in the hospital. So he doesn't interact with patients directly, but he does interact with the hospital's coordinators and like occasionally the healthcare staff. So usually like interacting with the patients isn't a problem, but like for instance, say he suggests to cut back on the physical therapy funding, which is my intended profession. So say he suggests to cut back on PT funding in a hospital to create a bigger budget for cancer treatment. He could potentially deal with an angry physical therapist who was let go because of budget cuts or is afraid of losing their job. So if the healthcare providers have a psychological disorder, this could cause drama like within the hospital. So like if a PT like had bipolar disorder, they would like, you know, maybe like become manic about keeping their job or something like that. What ways my profession or his profession would collaborate with my profession? So my intended profession, which is PT, would collaborate with people in Alex's only in the funding increase and decrease situations. So if I was working at a hospital in the PT department, Alex would come in and discuss new equipment that we might be getting due to budget increases, or maybe equipment and procedures we wouldn't be able to do due to budget cuts. So that's like the direct interaction that I would have with him. And then question 4, what information about their profession does someone in your profession need to know in order to understand what they do? Alex's job is to benefit the hospital financially to the best of his ability. So he wouldn't involve a lot of direct contact with me or like my patients, but his decisions will make a larger impact on like what we could and couldn't practice due to like budgets and like the equipment we have available. So that could mean gaining or losing certain clients due to budget changes.
So I know Rachel, I know this already, but I know that he like just graduated. How did Alex get that job?
He he literally applied to like 100 jobs in 100 days or something, like crazy. He's very motivated. He's a motivated kid. But he majored in finance, so he knows a lot about like the financial side, but he ended up getting this job because he applied to a lot of jobs. But it's in Reston, Virginia, so like really close to Leesburg, like where we're from.
Really?
Mm-hmm. So he's just gonna commute from home for a while.
Cool. When did he start?
He started like a week ago, so he's only been doing it for a little bit, but he basically told me that's the gist of his job.
Pretty cool.
Let's go next.
I guess I can. Okay. So I interviewed Sandy Wright, who's a traveling ER and trauma nurse. So her job is pretty cool because she works for a travel nurse agency, and you can kind of like apply for jobs that are posted on like the web her travel agency, and they're like all across the United States. So she can apply to specific ones that she wants, and she kind of like applies to jobs in places that she always wanted to live or always wanted to visit. So she's gotten to travel to a lot of cool places. And in relation to her job, I asked like how housing works for that, and they said that the agency sometimes can provide housing, or the individual nurse can like find her own housing and like get some money from the company. And some of the cool places that she's gone is, she said, she's lived on Cape Cod. She's gone to Vermont for the winter. She said some of her favorite memories were like skiing to work in Vermont and then walking to the beach from her apartment on Cape Cod with her coworkers after work. So she's done a lot of really cool stuff with her job. And then I asked her to describe like what she does and what a typical day is like for her. And so she said that at the beginning of her shift, she gets a report on which patient assignments that she's going to be taking over from the shift before her. And after the report is given, she visits the patients to introduce herself as being the new nurse and reviews the like where in the process that person is in the ER, and then takes over with what's left to be done. And that she normally has 3 to 5 assigned patient beds for 12 hours. And she said she loves what she does. And then I asked her how she works with psychology and how psychology affects her profession. And she said that she works with patients with psychological disorders on a daily basis, and that it's not uncommon for the ER to have anywhere from 1 to 15 like patients in their ER at one time. And she said that some of the disorders that she's worked with most often, or that she sees most often, is people with personality disorders such as borderline personality disorder and bipolar disorder, people with depression and anxiety, people with PTSD. And she said it's a pretty regular thing. And in relation to like how she collaborates with hospital administrators, which is my intended profession, she said like not a whole lot, and only really the department manager deals directly with hospital administrators. But she said that one thing that she's noticed is that there's not really a good relationship. And basically all hospitals she's worked in, there's not a really good relationship between like the administrators and like the clinicians and stuff. She said that she's noticed that administration tends to do walkthroughs in a parade-like fashion, and it always seems like it has a visiting dignitary feel, and they don't spend a lot of time on the hospital unit, so they don't really understand the business of what they're responsible for handling the administration of. And she said that she feels that a larger administrative presence on the hospital units would allow for a better understanding between the two jobs and would facilitate a better relationship.
So did she major in nursing or like do an accelerated program after college?
She did an accelerated program after college. I don't know where she went to college, but she is like in my family, but not direct family. She's like recently come into my family.
Like she married in.
Mm-hmm.
Gotcha.
Just recently, so she's been interesting to get to know because she's got a lot of cool experiences. And she originally worked in Northern Virginia, and then after working as a nurse for like I think she said 18 years, she decided that she wanted to travel. And she was like, this is the perfect way for me to travel but still work. And she's gotten to go to so many cool places. She said she another memory is sitting in a waterfall to recharge my soul in Vermont. And I was like, wow. So she's with her job.
That's really cool. I wish I could do that.
Yeah, I know. Yep.
All right, I'll go next. So I interviewed Tara Cottle, and she's a psychiatrist. She's been doing it for 13 years. It was through email. So the first email was, what made you choose this career? What do you do? And how does psychology play into your career? And she said, I chose this career because I've always had a passion for mental health, understanding why people do the things they do and knowing how to help them understand and how their mind works and live with what's going on is part of life. I diagnose and treat mental illnesses such as depression, personality disorder, and schizophrenia, and anxiety disorders. I have a few substance use from day to day. Psychology plays a major role into my career because it's all about psychology. The mind has many kinks and mysteries, and it's different for everyone. It's important to know psychology as well as the background information of each individual in order to diagnose the proper disorders and give the patients the right medication, refer them to the right specialist to talk to, and for possible therapies. And then the second email says, well, I said, thank you for answering those questions. I have a couple more. What ways would nurses collaborate with psychiatrists, and could there be possible altercations with them on how patients are being medicated? She said, I work in a healthcare setting such as a hospital, which includes working with nurses and CNA and other doctors in the facility. The nurses, what up? I messed up. The nurses administer medications to patients, and I honestly can't say I have any altercations with any of them, but I can see where altercations could fall into play, as if a patient begins experiencing other symptoms, which then would make me have to do a follow-up on the patient and diagnose the disorder. And then for email number 3, it said, thank you. I have one final question for you. And it says, what information about psychiatrists do nurses need to know in order to best understand what they do and how to work well with psychiatrists? And she said, nurses need to know not all patients are the same, and not everyone shows the same symptoms of others. That's why it's important to tell a psychiatrist of any observations the nurses could see that the psychiatrist missed or wasn't around. Being on the same page with nurses as well as other professions to give the best quality of life to patients is what we're here to do. And then I said, thank you for all your time.
That's cool.
How did you get in contact?
I found, well, my friend, she has this issue in her personal life. She actually told me about the first psychiatrist that she sees.
Mm-hmm.
So I would like to talk to that psychiatrist.
That's a cool connection.
Yeah, it was really, I got lucky.
Yeah. All right.
I guess I'll go next. I interviewed Dr. John Brown. He's a physician at one of the local practices here in Virginia Beach. He surprisingly had a lot of time on his hands. Like, the emails we had, they were very lengthy. So I'm gonna give you guys like the gist of what he said. For question 1, he said that he's a physician, of course, like I stated. He said that he was responsible for diagnosing and treating illnesses and injuries. He also examines patients and take like medical histories and stuff like that. For 2, he said, what did he say? He said that he usually would, if he had like a question about a mental illness, being that there's a psychiatrist on the same floor in the practice, they would like intertwine and conversate and stuff like that. For question 3, how would I collaborate with them? In the referrals, I would either refer my patients to him or he would refer his patients to me. That's how we would like work together, I guess. What I need to know about the profession, I guess I would say that their medical background, so that he actually did his job and recorded everything, all the medical histories and stuff like that, so that I can know if they're on any medications or if they had any pre-existing mental illnesses or stuff like that. My last question was, I asked him why he decided to be a physician. He said it was in the family and he always had a desire to help people.
I'm trying to think of questions.
What kind of specific physician is he?
Pediatric physician.
Oh, that's so cool. And he deals with kids who have like borderline personality disorder and stuff?
You said, does he work with kids that has borderline personality disorder?
Yeah, like kids who like have diagnosed like mental.
Yeah, pretty much all children. It's not like one specific. It's just children in general.
That's really, really intense. I can't imagine like being that young and having like something like that.
Yeah, exactly. It's strange, honestly. Like, you wouldn't think that a child could be diagnosed with borderline personality disorder.
Right, at such a young age.
Exactly.
All right, is Jonathan around?
All right. I don't know how this is gonna work, but
can you hear me? Hello. Okay.
Hey.
I interviewed Kimberly Link. I called her, and So the first question I said, what do you do? She said she manages and helps. Oh, she's a physical therapist, by the way. Sorry.
Okay.
She said she helps people heal from injuries by using techniques and different exercises. For question number 2, I said, how does your profession work with psychology? She says she may help people with psychological disorders, and once she had a guy with bipolar disorder. Whenever he was on like a really bad down, she decided to lighten up the environment and give bigger rewards if he was to do something right. And like, so for instance, she would bring cookies and stuff like that, you know. For question number 3, I said, how would your profession interact with my profession, which is going to be an OT? She said people who go to PT have major injuries such as leg and hip injuries, but OT has smaller injuries like hand and wrist. But if someone were to have both, they may have to go to a PT and OT, so we would exchange files that way. And then for the last question, I asked how her work would affect her ability to help understand the people that I intend to work with. She said they're close fields and highly interchangeable and related. So she said, check your OT patients' records for certain injuries. If you have to call their old doctor, you should do that in order to learn a little bit more about them.
Well, yeah, the part with the they're giving you was pretty cool. We can deal with that. All right. I guess we're done. Stop the class and it's going to stop this completely, or if I stop it, it's just going to go back to how it was before. So if it stops this, then I guess we'll talk again tomorrow.
Gotcha.
All right.
So let's see what this does.